Welcome to Gist Nigeria from the BBC and Channels Television, where we bring you the stories making the rounds on social media. I am Wale Fakile. Let's start with our top story. Nigeria has rolled out a first dose of COVID-19 vaccine across different media platforms. The video of President Muhammadu Buhari and his deputy, Prof Yemi Osinbajo, being inoculated filled the screens. But while the vaccine rollout appears to temper the year-long disruptions caused by the coronavirus pandemic to more living, there are doubts among some Nigerians whether or not to take it. Gist Nigeria's Ajoke Uluotse took up some of these concerns and got experts to answer them. Have a look.
The arrival of hope in the midst of despair. For more than a year now, the world has wrestled with a common enemy. The coronavirus has ravaged countries globally, infecting more than 100 million people and killing more than 2 million. Like many countries across the world, Nigeria has not been spared. More than 150,000 of its population have been infected, with close to 2,000 deaths. Despite this rising number of confirmed cases, doubts over the existence of the virus still abound in the country.
Me, I never see it. I lie the lie. Me, I don't see anything.
COVID-19 is not in Nigeria, and God will not allow COVID-19 to be in Nigeria.
On 8th December 2020, 91-year-old Margaret Canaan became the first person in the world to receive Pfizer COVID-19 inoculation, kickstarting an era of a global COVID-19 vaccination program. Since then, at least 7 different vaccines across 3 platforms have been rolled out in countries. Initial concerns over vaccine nationalism are being put to rest by the COVAX facility, a global initiative aimed at enhancing equitable access to COVID-19 vaccines by providing doses for at least 20% of the population in 92 countries. More than 3 months after the first shot of the vaccine was given, Nigeria welcomed its first batch of almost 4 million doses of the AstraZeneca COVID-19 vaccine, thanks to the COVAX facility.
For AstraZeneca vaccine, it is based on viral vector, and it is now being manufactured by Serum Institute of India, aside from the parent manufacturer in Europe. And it is a vaccine that, in terms of storage capability or storage property, it can be stored between 2 and 8 degrees centigrade. In terms of AstraZeneca, it's about 68% in efficacy. Compared to Pfizer and Moderna, it is lower because Pfizer is 95% and Moderna about the same.
Ahead of the arrival of the vaccines, the National Primary Healthcare Development Agency had launched the TEACH strategy, a combination of methods intended at rolling out the vaccines in the country.
So with this TEACH strategy, we will be rolling out vaccinations in designated health facilities all across the country. We'll also have teams of health workers that will be moving from settlements to settlements to get closer to where people live and work, and will be administrating these vaccines. But beyond that, we also recognize that there are people who live in very remote areas across bodies of water. Some people live in mountainous areas, places that are really, really dry. So we will also be deploying mobile teams to these populations so that no Nigerian who is eligible to get this vaccine is left behind.
Despite government's readiness to vaccinate the masses, there are concerns that not many Nigerians want to be inoculated.
If they have taken it there and we consider it will work here, then there's no reason why we should not take it.
I don't think it's safe.
So I would love to take it to prevent myself from COVID-19, and again, it also prevent others from this infected virus.
If we understand the genesis of COVID-19, then we can take any vaccine. But for now, we don't understand where it came from. So why taking it?
They are very good in giving us vaccine. What about the food? What about the palliative? So when it comes to drug, that is where their muscle will not be stretched. When it comes to food, what will enable us to have strength to take the vaccine? Okay, can an hungry man that is hungry take this vaccine? That's another thing.
Now, the relief that should ordinarily have followed the receipt of the first batch of the coronavirus vaccine may have been clouded by years of government mistrust conspiracy theories, and feelings of uncertainty. Many wonder, is the vaccine safe and will it end the scourge of the coronavirus?
The vaccine is safe. First of all, as we speak, countries are exchanging information.
I myself have had my first lot of vaccine. I will say so far that there has been no evidence to suggest that the vaccines, cause any problem more than vaccines will normally cause. And what do I mean? We've all taken the polio vaccine, we've taken chickenpox vaccine, we've taken so many vaccines. Our children have taken those vaccines. And normally vaccines, sometimes you may have some slight fever after vaccines, you may have some pain, some swelling, around the area where the shot is given. Sometimes, this thing, we see these things with our children. Sometimes there might be body pain, some generalized body pain, some, slight weakness and all, but nothing too serious.
To increase public confidence in these vaccines, Nigeria's President Muhammadu Buhari and Vice President Yemi Osinbajo were publicly inoculated, demonstrating vaccine safety to the citizens. But what exactly is this vaccine expected to do?
COVID, as with every other vaccine, what the vaccine does is to stimulate your body to produce antibodies against COVID. So that when you do get exposed to COVID, if you do get exposed to COVID, your body is able to mount a better response against it. And so that would manifest in a much less severe course of disease, even if the person gets COVID. Another thing it will likely cause, which is even a more likely option, is that the person won't even have any features of disease. Yes, the person may get infected, but from the studies shown so far, the person is more likely to stay asymptomatic. So essentially, it reduces significantly, as much as we know from the science so far.
So, what categories of Nigerians will be vaccinated first, and just how much will it cost?
First priority will be health workers that are in the front line. We're going to be also giving these vaccines to other, first responders. We're going to be looking at people outside of the health sector as well who are at risk of getting COVID-19. We're going to be looking at those strategic leaders like Mr. President, the Vice President, those people who will also want to take the vaccines publicly so that they can motivate their followers to take the vaccine, to convince them that the vaccine is safe. So that is sort of the first phase of the prioritization, right? The second phase will be around those people, again, who are likely to fare worse if they were to contact the virus.
It is free. I'm hoping that nobody will start gouging the public. It is free. The Nigerian government is paying for this, aside from the free ones that are being donated. It's supposed to be free, so people should not pay for it.
And should you be wondering if COVID-19 protocols can now be ignored once you get vaccinated, experts say we still have to wait a little longer.
The fact that one has the vaccine doesn't mean that one neglects the non-pharmaceutical precautions like using masks, like washing hands, social distancing, because bear in mind that this vaccine may not prevent people from getting infected, but it will prevent the person from being sick or being ill. So the non-pharmaceutical precautions will still be in place until everybody or almost everybody has gotten it.
The likelihood of herd immunity, a protection from an infectious disease when a significant population is vaccinated, is high. However, to get to this immunity level, government must continue to sensitize Nigerians to set aside their fears and embrace vaccination so we all can end the scourge of coronavirus as soon as possible. Ajoke Hulotse, Gist Nigeria.